Hi, my name is Megan Lamont, and in this presentation, I will share out of my 3 proposed mental health policy that I chose to support after weighing the outcomes and evaluating each option. So the 3 proposed policies that I originally spoke of were in regards to maternal health in Tennessee. And of those 3 proposals, I proposed either 1, extending postpartum Medicaid coverage to 12 months for all mothers in Tennessee. Number 2, mandating hospital participation in the Alliance for Innovation on Maternal Health and Safety Bundles. And then 3 is establishing a statewide community-based doula and telehealth maternal support program. The reason why I chose this topic is because I am currently pregnant. I am almost 16 weeks, working in healthcare and seeing some of the flaws in the way maternal care is handled, especially postpartum, things like that. This is definitely one that I think hits home for me currently. So, after reflection and analysis, I have chosen to support the extension of postpartum Medicaid coverage to 12 months for all mothers in Tennessee. So in this presentation, I will explain why I chose this policy, why I believe it is the best option for healthcare clinicians, and what I consider to be the strongest selling point for advocacy and health policy development. So I chose this policy because I want to support extending postpartum Medicaid coverage because it directly addresses one of the most critical contributors to maternal morbidity and mortality in Tennessee, and that's the lack of access to care after childbirth. According to the Tennessee Department of Health in 2024, their maternal mortality review and prevention report, it showed that many pregnancy-related deaths occur after the traditional 60-day postpartum coverage period ends. I think that we, in our minds as healthcare workers, think that there's this window after 60 days, you're not postpartum anymore. And I think that we forget it takes months and months and months, sometimes over a year, for any of those things to come back and be normal. We have to think it's not just the immediate postpartum care. We've got hormone imbalances, electrolyte imbalances. There's just so many things that affect moms after having a baby that are not properly addressed. So I think extending coverage to 12 months ensures that they have continued access to care for physical and mental health needs, such as hypertension, diabetes management, and postpartum depression, which often arise months after delivery. So this policy not only supports maternal health, but also strengthens family well-being. When mothers have access to ongoing health care, they are better equipped to care for their newborns and reduce the risk of infant complications. The policy promotes continuity of care, allowing healthcare providers to monitor long-term recovery and provide preventive services that reduce emergency visits and readmissions. So from a public health perspective, extending postpartum coverage is equitable and an evidence-based approach. So it helps close gaps for low-income and rural women who are disproportionately affected by limited access to care. And this aligns with national recommendations from the Center for Disease Control and Prevention and the American College of Obstetricians and Gynecologists, both of which emphasize the importance of continuous postpartum care up to 1 year after birth. So, why I think it's the best choice for healthcare clinicians as well. It's beneficial because it creates a sustainable framework for providing comprehensive long-term care, where clinicians often face barriers when trying to follow up with postpartum patients after their coverage expires. So extending Medicaid coverage gives providers the opportunity to establish consistent care plans, improve patient follow-up, and address chronic conditions before they escalate. So for me, I think that this could be anyone from nurses, midwives, physicians, and allows them to follow up and provide care. So there's numerous ways that obviously you can bill things through Medicaid. And so I think that by opening that door up to nurses too, who are more trained in a holistic approach and an overall approach to health and wellness in patients. I think it opens up the ability for nurses to do that follow-up care. I used to work on an orthopedic floor, and I used to make follow-up phone calls to patients, and we would ask specific questions to make sure, one, that they didn't have blood clots. So we'd ask about their legs. Is it warm? Do they have any pain? And I can't tell you how many times I would catch something with a patient with an infection or a blood clot, and we'd have them come in, and we saved a much worse outcome by just making these follow-up phone calls. So that's where my thinking was in coming up with this idea. So it enables clinicians to collect and analyze longitudinal data to identify trends and improve clinical outcomes. Moreover, this policy reduces the moral and ethical distress clinicians experience when they are unable to provide adequate follow-up due to financial or insurance constraints. It aligns with the ethical principles of beneficence and justice by ensuring equitable access to care for all mothers, regardless of socioeconomic status. In addition, clinicians working in rural or underserved areas would benefit from fewer gaps in care and improved patient engagement. If women have this option to follow up for up to a year, they're not going to be worried about that bill that they're going to get. They're not going to be stressing that if they go to the doctor that they're going to have to pay so much money out of pocket when it's covered. So the big selling point for advocacy and policy development is that it's a demonstrated return on investment and measurable impact on maternal health incomes. So extending postpartum Medicaid coverage is not only a compassionate policy, but a cost-effective one. Studies from states that have already implemented 12-month extensions, such as Illinois and Georgia, show decreases in maternal morbidity, decreases in emergency department visits, and decreases in costly hospital readmissions. So especially for these women that can't pay if they have coverage, the hospitals aren't eating these out-of-pocket costs. I work at a level 1 trauma center. We get tons of homeless people who have no money that can't pay these bills, and the hospitals are eating the costs. So why are we not coming up with solutions to these problems? From an advocacy standpoint, the policy is compelling because it addresses one of Tennessee's most urgent public health issues, which is maternal mortality. With a practical, evidence-based solution, it supports state and national health equity goals by ensuring that no mother loses access to care during one of the most vulnerable times in her life. For legislators and policymakers, the policy's data-driven impact makes it easier to justify funding. It aligns with federal initiatives like the American Rescue Plan Act, which encourages states to extend postpartum coverage through Medicaid. Advocates can frame this as both a moral imperative and fiscally responsible decision. So, by prioritizing this policy, Tennessee can lead by example in the Southeast and demonstrate that extending postpartum care is an achievable and sustainable step towards eliminating preventable maternal deaths. So, in conclusion, just to summarize everything that we just talked about, after weighing the predicted outcomes and evaluating each proposed maternal health policy, I believe that extending postpartum Medicaid coverage to 12 months for all mothers in Tennessee is the most impactful and sustainable option. It promotes continuity of care, supports healthcare providers, and directly addresses maternal mortality and health disparities. So this policy's ability to improve both short and long-term outcomes for mothers and infants makes it a top priority for advocacy and policy development. By ensuring mothers have the care they need during the critical first year after childbirth, we can move closer to achieving health equity and better outcomes for families across Tennessee. So, it's frustrating to have to think that we are just missing this last little step. We want so badly to care for our patients and do this, that, and the other, but then we lack out in the follow-through. And that's where we lose trust with our patients. That's where we lose the ability for them to really feel like we're connecting to them on a level that's much deeper. if we can follow up with a mom for 12 months after her child is born, could you imagine the impact on that in other areas too? If she doesn't have access to a lot of resources, but she feels like she can reach out to someone who walked her through her postpartum period for 12 months, how much easier is it for her to return when she has concerns about something else? I just don't see why this isn't something that we're already doing. With all the things that we can do that are just so simple, one follow-up phone call every few weeks, how hard could that be? And even if it's not something that they need to come in for, if they're doing well and they feel like they're thriving, but you're just asking those questions, and maybe something comes up and that dings a light bulb in your head like, oh, that might be something that's wrong. Then we're saving a mom. And what if she's got depression and she's thinking of harming the child? We're saving a baby. We're saving the mom from doing something that she can't take back. We're saving a child's life. Like, it's 12 months. It's 12 months of follow-up. It doesn't mean it's going to cure everything, but at least it could start. It's a start. Anyways, thank you for listening. Again, my name is Megan Lamont. It was a pleasure talking.